Mr. Speaker, thank you very much. Mr. Speaker, at this time I'd like to yield to the distinguished member of the Rules Committee, a gentleman who sits on both the Energy and Commerce and the Rules Committee. He is quite literally the most knowledgeable person on health care in the United States Congress. I'd like to give 10 minutes to the gentleman from Louisville, Texas, Dr. Burgess.
The gentleman from Texas is recognized for 10 minutes.
I thank the gentleman and thank the Speaker. Mr. Speaker, we all know why we're here. The problems that exist within the Affordable Care Act, and it is simply not working for the American people. Limited choice, costs going up, millions without access to care, and unfortunately, these are not just talking points, but real issues affecting real Americans. The Affordable Care Act has damaged the individual market. It has driven insurers away from offering coverage. Now we're seeing 1/3 of all United States counties with only one insurer. And among the plans that have chosen to remain in the markets, there have been widespread double-digit premium increases. The individual market is a death spiral, failing to live up to the promises made 7 years ago that Americans would be able to receive affordable health care. As we knew then, and we know now, this was an empty promise that has left an estimated 19 million Americans without coverage. What's worse, these individuals are forced to pay the individual mandate penalty or seek a hardship exemption because of the cost to purchase and use health insurance. 9 months ago, Mr. Speaker, we began our Better Way plan to save the nation's health care system and to bring relief to the American people. This plan, which served as a blueprint for the American Health Care Act, and it laid out the policies to stabilize the collapsing insurance markets and to repeal the more burdensome Affordable Care Act taxes and mandates that have hindered innovation and limited access to care. So let's take a look at what the American Health Care Act does. First and foremost, it provides immediate relief to the state insurance markets. As Republicans, we know that one-size-fits-all works for no one and certainly did not work for the individual markets. The states should have the flexibility to support their insurance markets and ensure that plans can continue to provide options for coverage. To do this, we relaxed two of the most egregious market regulations that were imposed under the Affordable Care Act. The mandates that premiums cannot vary for younger and older Americans by more than a 3-to-1 ratio, and the mandate creating fixed actuarial values for plans. The mandate limiting a plan's ability to set premiums by age has driven up the cost of coverage for younger and healthier Americans and has pushed away those seeking coverage by millions. Of the over 19 million Americans who have sidestepped the individual mandate, it is estimated that as many as 45% of these individuals are under the age of 35. Without these younger Americans seeking coverage, the markets have further plunged into death spirals as insurers hike up premiums year after year. To change this, we are relaxing the ratio to 5-to-1. It will lower premium costs, and it will provide necessary opportunities to stabilize the markets. Additionally, we're repealing the actuarial values mandate to provide insurers with additional flexibility to offer more coverage options. To further supplement these efforts, we're establishing the Patient and State Stability Fund. This fund provides states with $100 billion over 10 years to promote innovative solutions to lower cost and increased access to health care for unique patient populations in each state. The goal is simple: to provide states with maximum flexibility as to how they address the cost of care for their citizens. The Congressional Budget Office estimated that a combination of the Stability Fund and other proposed changes to the market would reduce premiums by 10% by calendar year 2026. We all want patients to have access to high-quality, affordably priced coverage. The Patient and State Stability Fund can help to lower costs. In Medicaid, in addition to supporting the insurance markets, the American Health Care Act creates needed reforms to the Medicaid program. Without changes, the Medicaid expansion alone is expected to cost $1 trillion over the next decade. Medicaid desperately needs reforms so that states can continue to provide coverage to children, people with disabilities, and other vulnerable groups. To address these concerns, the American Health Care Act first phases out the Medicaid expansion. The expansion that has crippled state budgets and limited states' ability to ensure that resources will continue to be available for those vulnerable populations. Additionally, our bill helps further bend the Medicaid cost curve by shifting programs toward per capita allotments. the per capita allotments, an idea that originated during the Clinton administration. Per capita allotments will set limits on the annual cost for growth for per capita expenditures, for which the states will receive matching funds from the federal government. The American Health Care Act increases the amount of flexibility that states have managing their Medicaid programs. The bill scales back the Affordable Care Act mandates that have limited the state's ability to tailor their plans to the needs of their beneficiaries. States can and should be trusted to manage the needs of their beneficiaries, and this bill allows states to do that. Additionally, the bill before us today furthers the goal of providing the states with greater flexibility in managing their Medicaid programs by providing states with the option to implement 2 additional opportunities: work requirements and block grants for Medicaid. This time around, we chose to engage our state counterparts in the discussion and listen to their inputs as we designed this bill. And at the top of their list were the desire to see the work requirement built in and the opportunity to work with Medicaid as a block grant. We don't tell them what to do. They're given the permission to do what they feel is best for their citizens. Republicans trust the states and trust the governors and the elected leaders in those states. Finally, the American Health Care Act provides additional resources to bolster state safety net providers. The bill provides increases in the community health center funding, offers enhanced funding to support safety net providers in states that did not expand Medicaid, and ends the cuts to the disproportionate share hospital payments. We are committed, Mr. Speaker, to ensuring that our local providers can continue to deliver life-saving care. The American Health Care Act turns this commitment into action. For millions of Americans in rural and medically underserved areas, these actions will provide needed relief that was undercut by the Affordable Care Act. Let me just say, Mr. Speaker, it has been an interesting process. We had a 27.5-hour markup in the Energy and Commerce Committee. We've had over 15 or 16 hours in the Rules Committee. This bill has been talked about almost talked to death. I want to just acknowledge that I appreciate the input of the administration. I appreciate the fact directive to us last night was to put our pencils down and turn our papers in. It is time, Mr. Speaker. This is a good bill. The rule deserves our support. The underlying bill deserves our support. And I yield back the balance of my